Good morning and welcome to the fourth part of our four-part Maryland legislative series, Legislatively Speaking. While we can't be together in person, we are thrilled that so many people are able to join us this morning. Before we start, I want to let everyone know that this program is being recorded. My name is Todd Rosenberg, and it is my pleasure to serve, along with my friend and colleague Bobby Schulman, as co-chair of the JCRC of Greater Washington's Maryland Commission. The JCRC serves as the public affairs and community relations arm of the suburban Maryland, Northern Virginia, and DC organized Jewish community, home to over 300,000 Jews, the third largest Jewish community in our country. The JCRC represents more than 100 organizations, synagogues, and the Jewish Federation in advocating for the needs, priorities, and values of the Jewish community, as well as the well-being of everyone in the Greater Washington region. Each year at the grassroots level, our advocacy work includes convening you, our community, for education and discussion, as well as for in-person meetings with legislators at federal, state, and local levels. This year, since we cannot hold our annual legislative breakfast in person, we have been bringing our elected officials and legislative priorities to you through this legislative series. We are pleased to have with us this morning Montgomery County Executive Marc Elrich, Montgomery County Council President Tom Hucker, and Montgomery County Council Vice President Gabe Albornoz, each of whom will speak for about 10 minutes on their priorities for the county for the upcoming year, as well as addressing the JCRC's Montgomery County legislative priorities. Following their remarks, JCRC's Executive Director, Ron Halper, will moderate a discussion. Please put your questions in the Q&A box and Ron will try to get to as many as possible. It's now my pleasure to introduce County Executive Marc Elrich. Marc Elrich was elected as Montgomery County Executive in 2018. He had previously served 3 terms, 12 years on the Montgomery County Council as an at-large member, as well as 17 years as a council member on the Tacoma Park City Council. He was a teacher at Rolling Terrace Elementary School in Tacoma Park. As a county council member, he was a chief sponsor of several landmark pieces of legislation and programs. He led the successful effort to increase the Montgomery County minimum wage in coordination with surrounding jurisdictions to $11.50 an hour, and subsequent legislation that will eventually increase the minimum wage to $15 an hour. He was the first elected official to propose a bus rapid transit system throughout the county to address Montgomery's transportation and environmental problems. He has provided exemplary leadership during the COVID-19 pandemic. Throughout his political career, he has been a champion of improving tenants' rights and for making developers pay for a greater share of the infrastructure costs to build schools and transportation solutions. Marc was a leader in the fight to preserve 10 Mile Creek in the Clarksburg area by limiting the proposed development that would have threatened the health of Montgomery County's last best stream, which flows into the county's backup water reservoir. Marc, thank you for being with us this morning.
Thank you all. I think like the rest of you, I'm really sorry we can't do this in person. I always enjoyed the breakfasts, and we were kind of joking before the meeting started about what I was looking forward to is, a bagel with some cream cheese and lox on it. And someday we'll figure out how to get these things delivered. But I just want to thank you all for letting me come here and talk a little bit about what I'm looking forward to doing, and what are the issues that we're really facing in Montgomery County as we go forward. So I'll give you an overview of, sort of what we're doing and then a little bit about where we're going. And then hopefully we'll get to talk about vaccine. I just want to say, I understand this has been really frustrating for people. And it's unfortunate. And, the more we got into it, the more we realized that Montgomery County's problems are a microcosm of the state's problems. The state only gets the equivalent of about 10,000 doses a day to distribute to all the counties in the state. And therein lies the problem. The governor does not have the ability to increase dosages. And I think there was a period of time when we didn't understand what the state's limits were. And they weren't forthcoming about what the limits were. And it kind of led to a lot of confusion and concern about doses not going out. But in reality, doses are going out. There just aren't very many doses. I was a little bit comforted that Biden said that by the end of the summer, he would have enough doses for 300 million Americans. That's probably about the timeline that it's going to take to get it done. But at least having a target I'm optimistic will actually help us, even if it's not the target everybody wishes. Biden can't manufacture a vaccine any more than Hogan can manufacture a vaccine, or I can manufacture vaccines. So we'll talk more about that later. So where are we with things? We are still in the midst of COVID. Our numbers are actually higher than they were in the spring when everything shut down. I keep reminding that to people when people say you should open more things up. And I'm saying, when we had numbers like this in the spring, we were totally shut down. So we have opened things, and then we've closed things back up as we thought we could get a better handle on the spread of the virus. Our goal has been consistently, particularly when we knew there was going to be the second and third waves that came, that we wanted the virus to have a smaller footprint in Montgomery County as we could get it down to, so that when it took off again, it started from a lower base. The virus doesn't lurk in the community, in buildings, and ductwork. The virus is in people, and it lives in people for a week or so, and then it either finds another host or it dies. And that's the thing about isolation and closing things down that was so important. The more closed down we are and the less contact people have with each other, the faster the virus dies out. And the more human contacts there are, the longer the virus spreads. So we have focused on trying to keep that reservoir base level of virus as low as we possibly could. Unfortunately, things like travel and holiday parties, starting in November, put a monkey wrench into that. Too many people traveled, too many people partied. Our numbers went up. They're still a lot higher than they should be. Our positivity rate is coming down, fortunately. And we are we're between 5 and 6 now. Back in the summer, we were between 3 and 4, 3 and 4%. Our cases per 100,000 are down to, they're approaching 30, but in the summer, just to put it in perspective, there were 5 cases per 100,000. That would mean we'd get 55 cases a day. That's no longer the case. And so we're dealing with that, but we're bringing the number down, and the number will continue to come down as long as we maintain as many safeguards as we can possibly maintain. We've been working with the state and federal government. I had a very positive meeting with the governor a couple of days ago. We have always been able to work with his staff. There are people who think that because the governor and I have disagreed about some things that there's no cooperation. Actually, I've always go out of my way to point out that even if the things we disagree over, we've always been able to work on everything else that's on the agenda. So there's been no price paid for disagreeing about one thing in terms of all the other things that we're working on. And we continue to cooperate such as you can with the federal government. It's much easier to cooperate now than it was only, was it 6 or 7 short days ago. So I think we're in a lot better place. I think, we've got the ability of the federal legislators to move an agenda forward that's going to provide more support to the state and county governments. More support means more money for personal protective equipment. It means more money for rent support for businesses and residents. Hopefully money for forbearance legislation on debt that businesses have accumulated during this time period. Much more money for vaccine. It is heartbreaking when you realize that the doses of vaccine that the government had were what Trump bought, and he actually could have bought more. And I'm just amazed that they didn't buy and contract for 600 million doses on day one, rather than buy 100 million doses and then think they were going to go back to the store later. These companies sold doses to other countries or other places that could have been here if this country had acted to buy those doses. And that's I think the heartbreaking thing about all this. We would have had less misery the sooner we had those doses, but it is what it is. And that's what everybody's trying to deal with. But it's a much better federal climate now. And there are a lot of exciting things I think will come with the new presidency. So stay tuned, and we can talk about COVID more later. One of the big things I wanted to do as county executive was reimagine public safety. I had started on this track as soon as I got elected. We have a work group that worked on decriminalizing homelessness. that they gave their report at about the time COVID hit last year. So that kind of messed things up. But as we're going through the reimagining, my task force just finished their work. I just saw a preview of their recommendations. I probably agree with 90% of the recommendations, and the ones I don't agree with are more about implementation or practicality than they are philosophically. So I'm, very excited about that. We're looking at, what do we do on the social service issues? Because crime is and always has been a reflection of social conditions in the community. And to the extent we deal with social conditions in the community, it has a positive impact on reducing the crime rate. If kids go to school and see a future for themselves and feel like they're going to be able to get jobs, they see their parents working, and that appears to be the normal way life goes, then kids tend to behave that way. And if kids are in households that are stressed, where people struggle for work and they struggle to pay bills and to keep a roof over their head, then that destabilization affects children. I know that firsthand because I spent 17 years teaching in what they call a high impacted school in Montgomery County, and poverty takes a toll on children and it affects behaviors, and those behaviors can last a lifetime. So, we're going to look at what we can do addressing that. We need a sobering restoration center in Montgomery County. It's not cheap, but it's important. Our jail is the largest mental health facility in the county. About a third of our jail population presents with mental health issues. So when you have your jail serving as a mental health facility, that's not a good thing. We need to be able to handle people who are drunk or having bad episodes with drugs or bad mental health periods, and not put them in a jail. We need to put them into a facility where they can get help and help them reenter as quickly as possible back into the community. We need to divert homelessness. Montgomery County's homelessness policy has been, for as long as I've been on the council, that people sleep outdoors 8 months a year. That is not an adequate homelessness policy. So we're looking at acquiring buildings to provide year-round supported housing for the homeless. The one thing about that population, there are folks who are going to present with lifelong issues that may be difficult to resolve, but a lot of folks are homeless just because they can't put down a security deposit, have a steady job, and those folks we can definitely help and move from homelessness to homes, which is our goal. And we're also looking at programs. Some of you may be familiar with Cahoots program or the SAMHSA mental health policing, where we send somebody other than police to every single call that comes into the station. Not all calls need to be handled by the police. Our call takers will wind up getting trained in how to determine whether this really is a police call or is it a call for somebody in the mental health system. There's a model in Oregon called Cahoots. We've been waiting for them to give us a proposal now for 6 months, but we're also looking at the SAMHSA mental health guidelines, and we look to move forward on this. We're doing work on affordable housing. There's an eviction moratorium right now. There's temporary rent control. I think rent stabilization should be permanent. People in lower incomes, their incomes just don't rise as fast as rents do. And so Montgomery County runs the risk of losing most of the apartments that are affordable. One report I saw from Park and Planning has us losing over a third of our affordable units in the next decade. We need to do something to stop that. Otherwise, the crisis in housing is even going to be getting greater. The county is undertaking projects, and we are requiring a higher percentage of lower income people. So instead of just doing moderately priced dwelling units for people making 60 to 70% of area median income, we're requiring bidders to provide 30%, 40%, 50%, and 60% housing in addition to MPDUs. And I mean, by percent, I mean percent of area median income. And I am trying to push the nonprofits to pivot toward ownership. If our solution to affordable housing is that we're going to buy a building and then rent it again to the tenants, you pretty much guarantee that this group will not build wealth. And we know that, the largest difference, particularly between the African-American community and the white community, is home ownership and the ability to build wealth. If you look at the rents people are paying, they're paying the same in rent as many Montgomery County families are paying for a $400,000, $450,000 home in Montgomery County. And that is devastating because I know I have the ability to borrow for an addition. I could help my kids in college. I could do a million things with the equity I built. And a tenant who spends 20 years making the same payment I'm making has nothing. There's no college fund. There's no ability to give their kids a down payment on a house. So that we need to address that. And I keep encouraging our nonprofits to help make that turn because they're the ones we rely on to do this. We are, still working hard in the field of early childhood education. Going back to my education roots, I know full well that if I could get kids into early childhood, at least from the age of 3, if not the age of 2, I can change academic outcomes for a lifetime. And so the work we're doing to try to make sure that we have more early childhood education available and affordable in Montgomery County, I think is going to help us change the future. And one of the other things that's just critically important into this county is economic development. We received a report that was done for the Economic Development Corporation that was thoroughly depressing. Montgomery County has been stalled for 10 years in economic growth. We have not been able to add jobs. And, I sat on the wrong side or the right side of a lot of 8-1 votes on zoning because people kept saying, oh, we got to rezone all this stuff and jobs will come here. Well, here we are 10 years later. We still don't have any jobs. We rezoned major parts of the county, gave away lots of density, reduced the requirements on developers to build infrastructure. And what we got for it is basically nothing. And we are struggling still to produce jobs. And that is our focus. So we have an economic development plan. We are working on focusing on the redevelopment of White Flint for the same reason that White Flint was what we proffered up to Amazon. It is an ideal location to remake in a significant way. It is the biggest landscape that the county has that sits on a metro that is relatively underdeveloped that we can actually move on. So we're talking to academic institutions. We have a joint development agreement with WMATA. I know that a couple of developers whose projects have been stagnant are repositioning their property plays toward the life sciences. And I think people are going to be really surprised. We have outside academic interested in coming to Montgomery County, interested in coming there. There are a couple of large corporations that are interested in doing work in the county and coming there. I think you're going to be surprised as we start to roll this out. But our goal is to create jobs. If we create jobs, we'll create a demand for housing, and that will deal with some of the unbuilt development in the county, as well as provide the one thing we've been missing for over a decade, which is a growing job base. And that's what I view as sort of like my job number one in the long term is making sure I can do that. Now, to do that, we're going to need a few things. We need infrastructure. We need bus rapid transit up and down the pike, because the same thing with Amazon. If I'm going to fill that area with development, that means I'm filling it with cars right now, and that's not going to work. So we need to provide the transit that's necessary to move people. But I'm pretty optimistic that we're going to be able to move in this front. I've had preliminary discussions with the governor that were very positive. And so I'm looking forward to more news around that. And things that we've done in the county, we have modified our procurement policies and our permitting policies. We handled 3 critical life science applications. One of the companies was so worried that they were thinking about going to Frederick rather than doing the expansion here. We were able to get their project done in a couple of months rather than in a couple of years. It was game changing. I have a wonderful new director over there, and they understand the mission. And we're not bypassing any environmental regs or anything else. We're just having people be responsive, focused on what they're trying to do, and working with developers so that if you fail a test or something, you know what you have to fix rather than just being told you failed and then try to tell you to go figure it out yourself. So we have a much more cooperative attitude. Our procurement department has made major changes. We have local buying preferences. right now, if you will get points if you're a local small business, local business period in Montgomery County, and you bid on a contract. And we're actually willing to pay a little bit more for a Montgomery County business getting a contract rather than a business that's out of the county or out of the state. And the simple reason, it came to us is when our economic development folks were selling us on why we should support a deal, they always talked about the multiplier effect of the money that would come into the county if we did a deal with, to bring a new business here. And we realized that that applies equally to doing business with businesses in the county. If I do business with you and you're a local business, your employees spend their money here, they buy property here, you're buying property here, I'm taking your property taxes and your income taxes and your inventory taxes. Any of you in the business community can make a list of all the taxes we're taking. So we have to consider that when we're considering what the deal is actually costing us. I could spend a little less money, send it out of the county, I get none of those revenues. So we have, gone in the direction of local buying preferences. We're making sure that we're going to meet our requirements for minority and women-owned businesses. And I think, we've gotten kudos from the business community on the changes we've made in that area. And the last thing is is climate change. We just released our climate action plan. It has a lot of things. It's immediately we're putting solar on a closed landfill. We have begun buying buses, electric buses. We are going to convert our fleet to electric. We've talked with the school system. They put out their first bid for electric school buses. We're hoping we can work with Pepco to create what they've got in Fairfax County, where the bus fleet was electrified and is used as part of the electric grid, particularly in the summer when ironically, it's the period we use the buses least. They can provide an important role in feeding the electric grid in the county and in the Pepco service areas. We're setting new performance standards for new buildings that'll turn these buildings green, but we're also going to have performance standards for existing buildings because that's the largest part of the environment. We're never going to build as many new buildings as we have existing buildings. And if we don't deal with the overconsumption of fossil fuels and the creation of pollution in those buildings, we will never, ever achieve any of our climate goals. So we will have standards. New York has it, DC has it. We're modeling our programs on what other folks are doing. And, we think that we can actually make progress on the climate action plan. We have to. I mean, if COVID were not the #1 crisis staring in our face, we'd be talking about climate every day right now. The news that came out this week about melting ice caps is absolutely terrifying. They're no longer talking about, oh, well, coastal areas might see another, 23 inches of sea level rise. They're now talking about many feet of sea level rise. And that is going to be a disaster. And we have very little time to deal with it. Montgomery County will do its part, but we actually need this to be a national priority. Now, I've looked at your agenda and I think we line up pretty well. We support your goals of providing an economic and safety net and protect those services in the county. And we're going to, in our budget, we're going to do everything we can to minimize any hits on the social service side. As we go forward, we are going to have a very hard budget this year, but we want to make sure we minimize the damage to this area and protect it and insulate it from some of the storms that we're dealing with. And hopefully the federal government will be helpful there. We're going to continue to support, the efforts to get grants and capital for operating budgets and for capital budgets to some extent. We'll continue to work with all of you. I know you have an interest in permanent security funding. I think this year is kind of a timeout, but we're going to go back to making sure that we help you harden your facilities. It's a real tragedy because I think all of us know this is not money any of us want to spend. You could be spending that money on teachers. You could be spending that money on scholarships. We could all be doing better things with that money, but we live in terrifying times. And we live among some people who don't respect civility and don't respect the right of people to look the way they do, believe what they do, think what they do. And so we wind up providing security for things that when I was growing up, we never thought about providing security for. As I said, you're advocating for criminal justice reform and police reform legislation. You will see that, and you'll see that in short order. And I'm looking forward to your participation in these discussions. We're going to continue to look at what work we can do, cooperating with the day schools. What opportunities there are. We've had some kind of conversations in the past, and I'm always interested in finding ways that we can be supportive in ways that we're allowed to be supportive, and recognizing that there is this separation, and they're not treated like public schools, and that's true for a reason. But that doesn't mean that there aren't things we can't do to help support the education of the children there. And there are some issues in particular that I'm interested in. And again, I said, you guys are have one of your priorities is supporting my draft climate action plan. I will be very happy to meet with your climate groups that are interested, and make sure we build a base in this community that helps us drive forward the point that we've got to act, and we've got to act now. I'm excited. I think, despite COVID, there are enormous possibilities ahead of us. I want to give credit to my staff over the past year who were tasked with dealing with COVID, but also thinking about the future. That was not an easy thing to do when the death tolls were mounting and everybody was, closing. It's real easy to say it's COVID and COVID only. But I've tried to emphasize for everybody that COVID's going to end. It really is. And when it ends, every problem that was here last March or last February is still going to be staring us in the face. So that's what we're trying to do. I thank you for all your work. Ron Halber, you've been a wonderful partner and a great representative for the community. And you all do amazing work in the community, and I really appreciate it. The one thing COVID has reminded us about is that a lot of the work that the county gets credit for, or people think makes Montgomery County a great county, is the work done by our nonprofits. You are the front face of compassion many times, and of caring and of support that people see. And a lot of that gets attributed to us, but I know that without you, we would have struggled to respond to the needs in the community. The government could not have done this without the assistance we got from the Jewish community organizations and all the other community organizations in the county. But for you, we would be in a lot worse place than we are today. So I just want to end by thanking you for all of that.
And thank you, Executive Elrich. We really appreciate your kind words. And now I'd like to introduce Councilman Tom Hucker. Thank you for joining us, Mr. Hucker. Mr. Hucker was elected president of the Montgomery County Council in December of 2020, a council member since November 2014. He's an ally to unions, tenant groups, and transit advocates. He chairs the Council's Transportation and Environmental Committee and serves on the Public Safety Committee. Councilman Hucker is one of two Montgomery County representatives on the board of directors of the Metropolitan Washington Council of Governments. He is the vice chair of the Washington Suburban Transit Commission, the state body that oversees regional transit service, including Metro and Maryland Department of Transportation. Mr. Hucker's entire career has focused on helping people make government more responsive and effective. First serving as a community organizer and environmental advocate, later as a nonprofit executive, and finally as an elected official. In 2006, he was elected to the Maryland General Assembly, representing Silver Spring and Tacoma Park, where he served for 8 years. As a state legislator, he authored and passed some 40 laws, including groundbreaking living wage requirements, children's health initiative, employee discrimination protections, wind energy expansion, and other environmental reforms. On the county council, Mr. Hucker has successfully championed initiatives to remove lead from school drinking water fountains and improve public transit, expand solar energy, increase attainable housing and home ownership options, and transforming policy. Welcome, Councilman Hucker.
Geez, Bobby, thank you so much. I don't know where you got all that, but even I was.
I assume it's
so I'm
true.
sure that your audience was too, but thank you for the overly generous introduction. Thanks so much to you for having me, to Todd Rosenberg and Ron Halber and Gabe Franklin, Janice Rosenblatt, and all the leadership of the JCRC. I'm really excited to be here with you today. Glad to be following my friend Marc Elrich, who's doing a great job under very difficult circumstances, and with my partner in leadership of the County Council, Gabe Albornoz, and I'm eager to hear what he has to say as well. It's really meaningful to be here virtually with all of you for this year's International Holocaust Remembrance Day, which of course marks the January 27th, 1945 liberation of Auschwitz. As Elie Wiesel said, to forget would not only be dangerous, but offensive. To forget the dead would be akin to killing them a second time. Today, it's so important that we honor and remember the 6 million lives lost in the Holocaust. And I'm especially happy to be with you today. We're all so proud to represent and live in such an incredibly culturally diverse community. The DMV is, as you know, home to the third largest Jewish community in the country. And I really want to thank you for everything you do, your continued work for our community, your continued advocacy, your communication with us during the pandemic. Echo everything that Marc said about your critical role. All of the leaders I mentioned this week, we had the pleasure of giving a special proclamation to recognize David Gansey at his retirement as well. But so many of you make such an important contribution and make our jobs a lot easier, because as Marc said, the county wouldn't be nearly the high functioning county that it is, and the role model for many other local jurisdictions all across the country, without the support of our nonprofit sector and so many of your organizations in particular. Let me start out by agreeing with the county exec too about your agenda that you've laid out this year, very much in line with our council's priorities and the work that we're building on this year. The COVID pandemic has been just incredibly devastating in so many ways and very difficult to manage our way through. We're dealing simultaneously with the worst health crisis since the Spanish flu and the worst economy since the Great Depression at the same time. And really, despite having great planning staff, nobody had planned for this kind of emergency. But it's also it's been very inspiring to see how our residents have stepped up and staffed our emergency medical corps and provided emergency food assistance and helped us get testing and vaccination done, and taken so many important steps throughout this emergency with great urgency and just tirelessness. And residents of other counties just don't step up like we have continually seen in Montgomery County. Over the year ahead, I think we have a tremendous opportunity to recover and to rebuild a Montgomery County that is more prosperous and more equitable and more sustainable than the one we have today. You all know the line about every crisis is an opportunity in the Chinese character. We've seen that this year. We've seen government that normally would put together a 3 or 4 year blue ribbon commission to study a vexing problem move more quickly this year than in previous years, partly because I think we all know the urgency of the times we're living in. The COVID vaccine, as Marc mentioned, is going to become much more widely available in the coming months. It was great to see the Biden administration order 200 million doses yesterday, which means we can look forward to a better Montgomery County, but we have to manage. We can see the light at the end of the tunnel, but we're in the tunnel right now. And we have to manage to get to that point. We have leaders in the White House. It's wonderful that we finally have ones that understand science and appreciate it and are setting in motion a national plan to deal with not just the COVID emergency, but are viewing all future policy proposals through two lenses: the lens of the climate crisis and the need to address racial equity. They've learned the lessons of the last 4 years and the last year in particular, and I am really excited about those two lenses that they've held up to view all potential policy proposals through as they're moving forward. All of us are looking forward to working more closely with the administration to get our communities vaccinated and to get more support to our families and our businesses. We've had 300,000 households in Maryland facing eviction. They're behind on their rent $300 million. And we've received significant support from the federal government at the beginning of the pandemic, but then of course, Mitch McConnell stripped out aid to local governments from the bipartisan package that passed through Congress at the end of 2020. So we're scrambling and hoping we're going to get a lot more support from the federal government in the next package. In the meantime, it's a little bit crazy that the state government has nearly $1 billion in the rainy day fund specifically saved for a day like today, the tsunami that we're living through, that hasn't been released by the governor, and $585 million in surplus, unexpected surplus from the FY20 budget that they haven't released either. So I've continued to advocate for additional support from the state. We've seen this rising anti-Semitism and racism, as you know, during Trump's 4 years in office. Everything from the Tree of Life massacre, but to the latest disturbing example being the anti-Semitic symbols and clothing worn by the mob that stormed our nation's capital just a couple weeks ago. The insurrection there shows the danger of tolerating the extremist narratives that have been out there for 4 years and much longer. And we have to work together to dismantle the systemic discrimination and hatred at every level, from the policing policies that Marc mentioned to the inequities that we've been tolerating in healthcare and education and housing for too many years. We've really prioritized making the county a safe and equitable place for everybody who calls Montgomery County home. And we believe the Biden administration is going to be a great partner at responding at the national level to show that hatred really has no home here. We're very excited, of course, to have not just the new administration, but included in there is the first woman and first person of color serving as our vice president, the first Jewish spouse of a president or vice president, the first Jewish majority leader in the U.S. Senate, Chuck Schumer, who is now the highest ranking Jewish elected official in U.S. history. We've had seen Anthony Blinken confirmed by the Senate as Secretary of State, and Janet Yellen yesterday at Treasury, and the most diverse slate of cabinet secretaries and senior advisors and top leadership in the nation's history, many of them Jewish. And of course, we're all so proud of our representative and friend Jamie Raskin, who's leading the impeachment efforts and defending democracy at a time of incredible personal challenge and personal heartbreak for him. And his leadership and hard work have been really, really inspiring. The early actions we've seen from President Biden and Vice President Harris are really promising and make us hopeful that better days are ahead. Our highest priority at the local level is to execute a comprehensive and coordinated statewide response to combat the pandemic, of course. This is essential to keeping everybody safe. As you know, I think the state gets their vaccines from the federal government, and we rely on a weekly allocation from the state. Montgomery County is doing a better job than any other county at administering vaccines, and yet we are not getting nearly enough from the state. We have 1 million residents. We asked for, last week, 20,000 doses, and we got 5,500. So at this rate, we're not going to be vaccinating everyone in the county unless the state ramps it up for well over a year, unfortunately. But we're working with the state through those problems. But the rollout has been very, very frustrating. We have 50 to 60,000 individuals who qualify for 1A status in Montgomery County, and we have 73,000 residents 75 and older who need to be vaccinated. The supply coming from the state has been, as I mentioned, less than we asked for. There has been an oversupply at the hospitals. At one point, they had 200,000 unused doses on the shelf. Some of that's being addressed in the last week or two, and some of the hospitals are sharing doses with us, and others have taken responsibility to vaccinate classes of our residents who are coming up next in 1B. We're also very eager to get our schools reopened, of course, particularly for starting with children with special needs that have a harder time than than everyone else in the virtual learning environment that all of our kids are struggling with. But we really are committed to doing so when it's safe to do so, meaning lower transmission rates and effective mitigation strategies in place, beginning with getting our teachers and the staff vaccinated. And if we're not getting enough vaccines from the state to do that, it's frustrating when you see the governor advocating to get all the schools open and threatening even to pull pay and licensing from our teachers when he hasn't given us the vaccines to get them vaccinated. So my own experience having a first and a third grader in a learning pod for a few months is that not just, even with a very high functioning childcare, nonprofit childcare provider, taking every possible precaution, masking and distancing and wiping everything down. My kids got COVID, gave it to me and my wife. My neighbors' kids got COVID. Same thing with many of my neighbors that were in the same pod. The whole thing was shut down. And I mention that only because that can happen with people taking all the precautions when you only have 12 kids in 3 different classrooms in an entire school. If we reopened up the school they go to, Rolling Terrace, with 900 kids and all the staff and teachers that it takes to run an operation like that, imagine what we're going to see. So we're really committed to reopening our schools as quickly as possible, as soon as we can get our teachers and our staff vaccinated so everyone's safe. And the same principle holds for our restaurants. We want to get those reopened as well. But since we've closed indoor dining, we've seen a whopping 60% reduction of COVID cases among our restaurant workers, 60% drop. So from a public health perspective, that was the right decision. Restaurants and all of our retail businesses shouldn't be in this false choice where they have to decide whether they would rather reopen in an unsafe environment or stay closed and lose all their money. They should be getting the help they need to stay open and stay afloat from the state government, which has not shared, as I mentioned, the $1 billion in rainy day funds and surplus that it's been sitting on. We're going to continue to advocate from the state and the federal government for the aid that we need. I was very happy to partner with Senator Van Carden, Senator Van Hollen, Comptroller Francho, Treasurer Kopp to call on the governor to release the emergency relief we need from the rainy day fund. We can't fight a global pandemic and the worst economy since the 30s, largely by ourselves. We really need our state leaders and particularly the governor's staff to release the tax dollars that we deserve from the rainy day fund. Beyond the pandemic, Marc talked about the climate agenda we're very excited about, reaching our housing goals that the council is very committed to, expanding our transit system. Marc's done a great job of standing up the state's first bus rapid transit system, which I'm glad is entirely in my district from Burtonsville to Silver Spring. And very quickly, even despite the pandemic, it's the third has the third highest ridership in the entire system. So we're continuing to expand our transit, address our climate goals, address our climate goals despite this very difficult time. And I'm very optimistic about our ability to do that working together as soon as we can reopen the economy safely. So I want to wrap up, but I want to just echo everything Marc said about your role and the critical nature of the services that you provide and the leadership that we're so grateful for. And I really look forward to your questions.
Thank you. It's now my pleasure to welcome Councilmember Gabe Albornoz. Councilmember Albornoz was elected Council Vice President in December 2020. He's a lifelong resident of Montgomery County and a product of our great school systems. He is deeply committed to our county, its people, and he is the son of immigrant parents. And such, he's committed to diversity in our communities. During the Great Recession of 2009, Councilmember Albornoz was able to maintain excellence in the Recreation Department, despite the challenges of an austere fiscal environment. Under his leadership, the department expanded programming to vulnerable populations, and with its dedicated staff and volunteers, has received dozens of awards for programming excellence from organizations such as the National Association of Counties. Just this past year, the Recreation Department received 8 national awards, more than any other department in the country. Highlights of his tenure as director include construction of 4 new senior centers, 6 new recreation centers, and major renovations to 6 others. Councilmember Albornoz is respected for his ability to forge collaborations with a wide range of stakeholders for building innovative programs such as Excel Beyond the Bell, TeenWorks, and Tech Connect, which helped close the achievement and opportunity gaps for thousands of participants and ensuring vital living for our senior citizens. Councilmember Albornoz, thank you for being with us this morning, and you are certainly, maybe last, but certainly far from least. Thank you.
Well, thank you, Todd, very much for that introduction, and thank you to the JCRC leadership. I echo Tom and Mark's comments about just the critical role that JCRC plays in our community. You are a very important part of our social safety net, and before the pandemic, you were an incredibly important partner, and that has never been more important than over the last year. And it has been an extraordinarily difficult year. I have the honor of serving as the chair of the council's Health and Human Services Committee. And our office is often forwarded messages from constituents that are in crisis. And all of our offices have been tackling that. But the level of crisis that our constituents have been facing over the last year is overwhelming and heartbreaking on a number of different levels. Over 220,000 county residents have filed for unemployment. Our kids have not been in the classroom in almost a year. And we are seeing, even now, that there are 5 zip codes in Montgomery County that continue to have a disproportionate impact from the virus, with the highest rates of positive test cases, with our Latino community having the highest rate of positive test cases, and our African American community continuing to have the highest rate of deaths. And so the challenges before us are immense. And as Tom mentioned, we are also deeply concerned about the tsunami of evictions and the housing crisis that we will be facing before us in the coming months. And of course, our businesses have been struggling mightily, many of them failing because they have not been able to survive. But despite all of that, and the challenges are immense, and some days, as I said, overwhelming, I actually am optimistic about this upcoming year. The next several months, our first, second, and third priority will be to work with our state and federal partners to disseminate the vaccines and take some of the lessons learned over the last month and dramatically improve over the next month communication, coordination, so that we can more efficiently secure vaccines and be able to administer them as quickly as possible. As Tom said, Montgomery County is leading the way, and once we receive the vaccines and actually getting them in people's arms, thanks to the partnerships that we have with our hospitals, thanks to our excellent Department of Health and Human Services. But as he also said, we do believe that there is an opportunity for us, although limited in the overall amount, for us to receive a higher percentage of the doses that the state is receiving. As we recently learned, the state had understandably been using a formula that was based on population. Montgomery County has a population between 18 and 20% of the overall state. So we were getting between 18 and 20% of the vaccines on a weekly basis. The challenge with that is that the smaller counties, such as Talbot, which leads the way across the state in the percentage of residents that have actually been vaccinated, has a population of 37,000 people. Rockville has a population of 65,000 people. And as Tom said, there are more than 70,000 people just over the age of 75. And so when the governor publicly announces that as a state, we have moved on to phases B and C, he's not wrong in that the smaller counties are positioned to be able to do so because their populations are so much smaller. But unfortunately, it creates confusion because Montgomery County, because of the large population, because we have so many people with 6 hospitals, as well as people that work for NIH and Walter Reed that reside here in Montgomery County that are in 1A, it's been difficult for us to be able to move and advance to the next phases. And so we are working with the state to stand up additional sites and have the capacity right now, today, to be able to administer between 2,500 and 3,500 vaccines. And so we have the infrastructure, but as the federal government pushes to ramp up more dissemination of vaccines and better coordinates and better creates cohesive policy that will put us in a better position, we will be able to stage up and stage up more quickly. The other issue that we need help with, and we are working with the state on, is communication and frankly, technology. There is not a one-stop shop. And so what you have now is people understandably registering wherever they can find a link or when a link is forwarded to them to be able to sign up. This will improve over time, but this chaos that we are experiencing right now is disorienting and immensely frustrating. And we are also being crushed by constituent calls regarding this very issue. People are scared, and understandably so. But I appreciate the efforts of the county executive, who did have a productive meeting with the governor earlier this week, and we're hoping that that leads to discernible change. Later this afternoon, my colleagues and I on the council are releasing a letter that we are sending to the governor, further asking for clarity on a variety of issues. And I'll focus on one for right now because it crosses over importantly into the work of JCRC, and that is our disability community. There has been tremendous confusion over when and who and how people in our disability community will be receiving vaccines. And so we are working closely and are addressing in our letter issues within our disability community to further clarify so that we can provide correct information in real time. This is absolutely important and a moral responsibility, but also from a public health standpoint, a critical responsibility as well. So I want to get to our questions, and I know we're pressed for time, so I'll just mention a few last things. In the upcoming year, as chair of the Health and Human Services Committee, I am going to be focusing very much on the disparities in healthcare that existed prior to the pandemic. We will be hosting a public health summit later this fall. I'd love to partner with JCRC on the development of that summit. We're also going to look at taking advantage of policy opportunities around telehealth, telemedicine. We're looking at the development of a circulator bus to be able to better get people to and from medical appointments. And we're working with our minority health initiatives and program to stand up initiatives that will better meet the needs of our minority communities who, as I have said, have been disproportionately impacted by the pandemic. All of these efforts collectively, I think, are going to make a difference. And I'll end with this. The most important reopening right now is undeniably our schools. Our kids are experiencing trauma, and obviously those students that are economically disadvantaged more so, but every student, regardless of where you live, has experienced social and emotional distress over this last year in ways that are difficult to quantify. And so from a mental health standpoint, we are committed to working with our community-based organizations, our faith-based organizations, our communities and leaders that have a trusted position within communities to empower them, to provide them with support, to provide them with resources to meet communities where they are and to help them get through this extraordinarily difficult time. So there's a lot more to cover, but I just want to end with the notion that collectively, we truly are going to come out of this stronger than we were before the pandemic. I really believe that because we have the infrastructure in place here in Montgomery County and very strong partners such as JCRC that are going to be able to get us over this hill. So thank you all so much. Ron, I defer to you for the last few minutes to answer some Q&A. Thanks so much. It's been an honor being with you all this morning.
Councilmember Albornoz, thank you so much. Can everybody hear me okay? Okay, great. Well, first of all, it was wonderful today for the county executive and for our county council leadership to join. I'm going to take the liberty of extending this call by an extra 5 or 10 minutes, just so we have a little bit of time for Q&A. And if people can't, if somebody has to step off the line, we'll continue with whoever else is here. But we want to give our audience a chance to participate. I'm not going to mention what our legislative agenda was because our county executive already went ahead and during his portion told everybody what our county executive, what our legislative agenda was. And I do want everybody to notice that Deborah Miller, who is in one of the boxes that is blackened and turned off and there she is our new Director of Maryland Government and Community Relations, and welcome her to this post. first of all, what I'm going to do is I'm just going to pose a question. I'm going to let anybody answer, and we'll just go through, and everybody can take a turn so we can maximize participation. The first question I'm going to combine 3 questions into one. One, there is concern about the coordination of the distribution of the vaccine in Montgomery County. And the second question, and if we can discuss that, and the second one is that a lot of people are expressing concern over the reopening of schools. And I think it might be helpful if you can explain maybe perhaps how decision making is done about that, so people have a greater understanding of what is within your control, what is not in your control, and how this is developed. Because from the external thing, sometimes it looks like there's a lot of battles going back and forth and politics being played. And I know that obviously we're a science-driven county, and I'm trying to figure out, and I think people would appreciate that. So number one is talk about the coordination of vaccines in our county. 2, talk about the coordination of school openings, and I'll give each one of you a chance to talk about it. Start with the county executive.
Yeah, so this was the subject of my meeting with the governor earlier this week, because the state has a broken system. Montgomery County, like everybody said, we get a set of doses from the state. Some weeks we got 7,000 new doses. We got a low of 5,500 last week or this week. But our partners are getting another 10,000 or more doses. So in all, the county's actually getting between 18 and 20,000 doses for distribution to county residents. The problem is everybody has to be scheduled through the state's prep mod system. In other words, I can't schedule somebody. I have to pre-register and then send you a link to go to prep mod to register. The governor's system, which they talked about yesterday at their press conference, can't distinguish between a 65-year-old, a 75-year-old, a person with a disability, and a teacher. And so when the governor opened it up and said, we can vaccinate everybody, including 1C, which is the 65 plus, everybody floods into the system. If they meet those criteria, they get a list of sites in Montgomery County, for example, and then they try to register an appointment on those sites. So if they come to my sites, we're trying to focus on 75-year-olds. They're taking vaccines away from 75-year-olds. The other sites don't get very many vaccine doses. The only one with a significant number of vaccines is Johns Hopkins. This week they got 10,000, and they got the extra doses, not the county, because they got Pfizer, which requires the deep freeze, rather than Moderna, which the county could handle. So they got the doses because they were the ones who had the freezers that could handle it. But I asked the governor to to change the registration system so that if you're 75 plus, you're directed to the Montgomery County healthcare site first, and the other sites will do 75-year-olds. But if you're 65 years old or a teacher, that those people are directed to the other clinics and the hospitals who are doing the other people. And their software wasn't set up for that. I mean, if you think about it, and this is where, it's really easy to get angry and blame somebody, but this system was meant as a universal vaccine system for the state of Maryland. You went in there were no criteria for who were going to get the vaccine. You just got it. They didn't realize, and frankly, I wouldn't expect the governor to realize the workings of a registration system embedded in the health department. But I talked to them and they got it, and they said they're going to work on it. They mentioned it yesterday in the press conference. So hopefully we'll get a solution. That'll take care of the chaos. But people are also being mailed invitations to register. So some people, they pre-register with us. They get a notice saying, you can go register now. They're sending it to their friends. That is further clogging the system. And we were trying to get the state system to accept a unique identifier. So if I send you a link and it has a unique identifier, you can't send it to your friends, and they can't then use it and apply that same identifier. And we've had problems with people scamming the system, people who are way underage getting vaccinated, people having friends who are friends who can get them one of these invitations to register. So we're trying to deal with that. But this starts with the state being the source of all the reservations, and that we're trying to fix. I think
it also starts with a little bit of people's own ethical responsibility.
There is that too.
Yeah.
I mean, that's frustrating, but the state could have fixed this just by making sure that you couldn't register. So they understand what we need them to do. As far as the schools go, and this is another complication. If you want me to focus on 75-year-olds, but you want to open schools by March, I need to get the probably 8,000 teachers that are going to come back vaccinated between now and March with both doses. So that's going to be 8,000 doses that either would have gone to 75-year-olds, the disability community, or 65-year-olds that are now going to be carved out for teachers. So the school system has a list of who they think is going to come back. We are working with them. We've got an arrangement with one of the hospitals. I think will be the one that does the vaccinations. We will probably be able to get people vaccinated. If they can do the quantity they said they can do, it would take 2 weeks to get 8,000 people initial doses, and then they come back 3 weeks later, hopefully with the Pfizer. That'll change the calculus on how the schools open, but it still means you still got to limit classroom size because you're protecting the teachers, but that doesn't protect the kids. And everybody worries about the kids because the kids are silent spreaders. I mean, Tom is unfortunately a perfect example of that. The kid who probably got sick and spread it, probably nobody knew they were sick. And I've pointed this out. Contact tracing relies on finding the first person who's the source of the infection. If it's a child and the child doesn't get sick and present with COVID, you don't know who the first source is in the classroom. You can go back and say, well, that teacher was in this school, but no kids in the classroom have COVID. Therefore, there's nothing to trace here. Mm-hmm. Only when you find a case do you have something to trace. So it has been very complicated, but I think we're working with the schools. The governor's been very strong. I think the school system's modifying their plans to meet some of the governor's things. And I will say lastly that when I talked to the governor, he actually said to me, you guys should still be in 1A. Mm-hmm. And there has been, and if you read what he's written or his staff has written, you could see how we were allowed to calibrate what we were doing. But the public statement of I'm opening the state up to 1C, that's what everybody hears. And they don't hear us saying, but we're still in 1A. And I've got, and 1A, by the way, for the rest of you don't know what we're talking about. 1A is the healthcare and all the front-facing workers who were the first priority because they're the ones most exposed to COVID. And they're the ones you want to be able to take care of you in case you get sick. So that's where we were focusing. But he actually said, you guys are still in 1A. You should be, So we're gonna finish our 1A. We're gonna get into we're doing the 75-year-olds. As soon as we're finished with the 1A group, all our doses will go to 75 years old. As soon as we're done with 75-year-olds, we'll join the other institutions in the county doing 65 years old. I think the state will eventually get this right, but I attribute no ill will or bad intent to them on this. It's just a system that wasn't meant to deal with this, as many of the systems we have are not meant to deal with the problems we're dealing with.
Thank you, County Executive. I mean, I think people do have to realize this is a unique situation. We only get a pandemic about once every 100 years. So if Councilmember Albornoz or Councilmember Hucker would like to add anything to that discussion about vaccine distribution or our schools opening, please feel free.
Well, I think Marc very well described the challenge and the source of the confusion. The only thing I would just add that I think isn't well understood, and it's a source of confusion, is that there's at least two parallel and not complementary systems. And people ask us, well, why isn't the county telling us, when we can register? Why can't we register at Giant or CVS or whatever through the county? We don't have any control over the hospitals, which are regulated by the state, nursing homes, same answer, or the private providers. They are getting their doses from the state. They will manage their own system from the state. The only vaccination that we have control over are the doses we get from the state, and through the people we can register then and vaccinate through our own centers like the Dennis Avenue Health Center. Beyond that, we don't have any control over the hospitals, nursing homes, or private providers, even if they're in Montgomery County. So that's a source. It'll be nice if we could get all the registration opportunities on one page. But again, we don't have any control over, these particularly private providers, as the state is expanding them, as they should, which is great. The more giants that can vaccinate people, the more CVSs that can, that's great for the world. The sooner we all get vaccinated, the safer we are, but we don't have any control over that at the county government level.
I'll just add one thing really quick, Ron, and that is to describe sort of the decision-making infrastructure regarding a lot of this. The county executives team in the executive branch that helps facilitate these decisions and is principally working with the state includes the Director of Health and Human Services, Dr. Raymond Kroll, Dr. Travis Gales, who is our public health officer. Dr. Gales has a unique position. He is technically a state employee. He technically reports to the Secretary of Health at the state level, but he is appointed at the local level by the council and the county executive. And so Dr. Gales is working principally in coordination with the other public health officers and working in tandem with the Secretary of Health as we make these decisions. The other thing that Dr. Gales has been doing, to his credit, is meeting regionally with the District of Columbia and Northern Virginia as well, because frankly, we have more in common with them than we do the rural counties in the state. And so he has continued to meet. The other very important person in the decision-making process is Dr. Earl Stoddard, who is the Director of Emergency Management Services, and also is part of a network of emergency management directors at the state and regional level. They are our point team in coordination, and they help advise the county executive on the development of public health executive orders, and then help guide and advise the county council, sitting as the Board of Health, to ratify those orders and ensure that they're administered across the entire county. And they've been working day and night now for the entire year in addressing some of these issues in real time and put us in the best position to help alleviate some of the confusion.
Thank you. Let me ask you a little bit. When my friend Isaac Snyder asked in the question and answer box, mental health. Children are really suffering. We had a mental health crisis before the COVID started, and now it's only exacerbated. If we can take a moment or two, I'm going to try and rapid fire some questions so we can get them out there. What we're doing, I'll start with Tom, Councilmember Hucker, rather. Tom, I know you for 25 years, Tom. Okay, to go ahead, and if you want to address the mental health, then if Gabe and Marc want to chime in on that afterwards, it'd be fine. So issue is mental health, children, increasing during COVID. How do we handle this?
There's, I think, both short-term and long-term answers. And I'll actually defer to Gabe for some of this, since he chairs our HHS committee. Many of us are, trying to see the question so I can appreciate it, have been advocates for getting more mental health counselors in our schools as part of the long-term solution. I think that's something that's been overdue and would have been welcomed years ago. It's particularly important right now. We've seen, absolutely many more calls for mental health services. We've even seen an increase in youth suicide now under COVID, and we really need to respond quickly to it. I think some of that will be addressed with the county executive's budget that he'll be sending over to us soon. And a lot of it is expansion of the services that are provided by our nonprofit partners. Anyway, I'm sure Gabe has other stuff to elaborate on that, but I think all of us are aware of the problem and want to address it as quickly as possible.
Well, Tom's absolutely right. It is an overwhelming issue. We hear it every day, and certainly within youth, but parents as well, who are feeling the economic strain and are frankly taking out some of those frustrations, within the context of their families, which is a huge issue. And I'm also very concerned about our providers who've been working around the clock and who are exhausted and overwhelmed. And so this is a systemic issue that existed, again, like so many prior to the pandemic. As Tom said, in the short term, we've increased funding and resources for community-based organizations and MCPS to be able to try and put more people out in the ground, particularly with clinical experience, that can help address those crisis and significant needs. But then we're also going to have to flood the zone and support community-based organizations in those other ancillary support programs, after school and enrichment programs. We have launched these education equity hubs, which have been immensely successful, but are meeting a small portion of the demand that's out there. And so, and that is another reason, for social and emotional reasons, that we have to get our schools open. We have to do it safely with a sufficient amount of PPE, with an aggressive plan for vaccines. But we're going to be in the best position when our students are back in the classroom for administrators and teachers to be able to assess what's going on, but also provide more wraparound services and support for those kids. But it is among our highest priorities going into this upcoming year.
Expect when the children get back to school that there's going to be a lot of reacclimation, a lot of
Yes.
stress. I mean, it's you know, I don't think it's like, I don't think these psychological challenges are going to be turned on and off like a switch, but rather are going to be lingering from an effect. I mean, for children who left, like my daughter who left in the middle of her freshman year of high school and will be returning probably, my thought is schools are going to open in August. That's what I just think is going to end up happening. And then if they do, she's going to end up going back as a junior. And think about the year and a half and all the challenges all of our children are going to have just reacclimating to schools. County Executive, I was struck by your, if you could talk a little bit about the schools. I mean, it's a little bit about mental health challenges, but I was struck by your comment that our prison is the largest mental health facility in Montgomery County. That was pretty much laid an imprint on my mind. So however you'd like to address the mental health issue, please go ahead. You're on mute, by the way.
I mean, the sad fact is that's what our prison system is. And, at least a couple of the police shootings involved folks with mental health issues that, and one in particular, it presented like a regular call for service from somebody who was threatening. And then within the space of a minute and 19 seconds, turned into a police shooting with somebody who had a mental health issue. The situation is not getting better. We know that there's probably more child abuse and spousal abuse occurring now, and people do not have the ability to get the support because they're not out with their friends or their coworkers and saying, I need help. And so a lot of this is bottled up inside of people's houses. We know this is going on. We, and I don't just mean Montgomery County, it's state of Maryland and this entire country, have never adequately funded mental health. It's not adequately funded on your insurance, which is why people don't, routinely, I mean, it's expensive to get mental health care. It is not something that insurance, gives you the kind of coverage that you need, which makes it a major, major problem. And for people without insurance, it's just totally out of reach.
County Executive, if I can give a plug for the Jewish Social Service Agency at this time, who accepts anybody for mental health, regardless of ability to pay, accepts every insurance, and is one of the few, I think maybe one of the few providers that accepts Medicaid. And so I just say I'm pretty proud as a Jewish community that we provide thousands of therapy hours at incredibly reduced rates, which is subsidized by private Jewish philanthropic fundraising.
This is what I said before. You guys provide an awful lot of support. We need more, frankly. We've got to figure out how we scale things up to a reasonable level. I had a meeting with a bunch of high school kids before the pandemic, and they were telling me about nervous breakdowns in schools, kids being taken to the hospital from the classroom and spending a week over at MedStar. And I'm thinking, because I went to school in Montgomery County, nobody ever had a breakdown in school. Nobody was taken out of a school and taken to a hospital for a mental breakdown. None of my friends went through any of this. Something has changed, and I don't think it's a good change. There are things going on in our society which are not necessarily healthy. Maybe it's pressure on kids to some extent, but it's a variety of different things that are problematic. But we need to have more resources. The school system absolutely does not have enough counselors. They're not even close to the recommended ratio of counselors or psychiatrists or psychologists in schools. When I was teaching, I had, one for an elementary school of 935 kids. Good luck providing quality service with that. And she was a really, really great person and totally compassionate. There's problems in the state law where a parent has to give permission for a child to see a therapist. And so even if you were worried about a child, if the parent says, I'm not signing that permission, you don't get to talk to the child, which means you don't get to find out what's going on. There's a lot of things that need to be fixed. And maybe as we pull out of this, we start thinking about where do we make these investments and how do we change rules so kids who need help can get help.
Right. So we're at 9:46 now, and I know everybody's got to go. I'm just going to give each one of you 30 seconds to say whatever is on your mind, and then I'm going to turn to close, and then I'm going to turn it over to Bobby Schulman to close, and we'll start this time with Councilmember Albornoz. If you have 30, Albornoz, if you have 30 seconds, if you want to just sum up any ideas or you want to share with the community that's joined us today.
Thank you, Ron. We're going to need help moving forward, more so than we ever have before, both from a social service standpoint and program and social service delivery, but also to think through some of these complex policy issues that led to the disparities that we're experiencing right now. And so I will be reaching out to JCRC in the coming weeks, months, and over the entire year so that we can collaboratively work on some of those solutions. I remain extraordinarily optimistic that we are going to come out of this stronger. That's not just Pollyannic. I mean that sincerely and authentically, because it's when crisis happens that system change is in the best position to actually occur. So thank you all for your continued leadership. Look forward to the continued partnership.
Thank you, Gabe. Tom?
I fully agree with everything Gabe said. And just to emphasize it, I mean, we are, as I mentioned, dealing with the worst health crisis and economic crisis in 100 years. And I've scoured the office for the pandemic and recession manual, but I can't find it. So we've been fumbling through as best we can.
I think Marc was looking for that as well, right?
We have great professional staff, and we're making the best decisions we can with limited information office usually, and limited authority given what, the amount to which the federal government and the state government control healthcare regulation. But it's encouraging how great talent pool and human resources we have in Montgomery County with partners like JCRC. So we don't have all the good ideas. We want to hear all your good ideas. Your fingers are on the pulse with the community. You're on the ground and you see the problems often before we do. And we need to, as Gabe said, work really closely with you over the coming year to address them as best we can.
Thank you very much. Thank you so much. County Executive, Marc.
Yeah, look, we've been through this now almost a year, 11 months. And for the first time, there is actually, not just a light on the horizon, but there's something that we know when it happens will change the trajectory of this virus. There are vaccines. They are going to get out there. Our lives will return to something somewhat more normal. Maybe this will be like the flu. Going forward, there's a lot of work being done. We need people to stay patient. If one thing that I think that's kept Montgomery County's numbers as low as they've been has been really good adherence to mask orders and to maintaining physical distancing. We know over the holidays when people didn't do that, we saw a spike in cases. That's the only thing you can attribute that to. Those holidays are gone now. If people can get back and just be really, I'll say rigid and really serious about what we need everybody to do, we will get out of this. And the important thing is I want us to get out of this with as many of our friends still alive at the end of it as possible. That has been my focus from the beginning, was to make sure as many of us survive this disaster as could possibly survive the disaster. So money can be replaced. Lives cannot be replaced. You will not just miss people, there will be aches in our hearts for the people who die. If you lose a business, that's bad. Hopefully the government can do something about assistance, but there's no assistance that compensates for the loss of a human being. And so I'm just asking people to be patient, stick with what's worked for the county so far to keep our numbers as low as they've been. And we will get to do this. And a year from now, we'll be doing this meeting in person.
County Executive Elrich, Marc, County Council Member, Council President Hucker, Council Vice President Albornoz, thank you for your friendship. Thank you for your leadership. Let me turn this over, and thank you for your time today. Let me turn this back over now to Bobby Schulman to close.
Thank you.
Yes, I thank you so much for this very interesting and enlightening morning. And we really appreciate knowing that you all are working so hard to try to work all this out for us. And of course, we also appreciate your deep commitment to our Jewish community. And we look forward to many more years of friendship and cooperation. And we'd also like to thank the sponsors of this legislative series: Marilyn Wynn, Richard Goldstein, Jennifer Mizrahi, Jocelyn Krefscher, Hillary Smith Kapner, Bobby Schulman, and Stein Sperling. Mark your calendars for JCRC's annual Maryland Jewish Advocacy Day. This year, of course, we'll be holding it virtually by legislative districts, beginning on February 1st and continuing with every other Monday through March 15th, with a special session with Governor Hogan on February 15th. For full information and to register, go to your JCRC website at jccouncil.org. Remember, Advocacy Day is your opportunity to speak directly to your elected representatives. Thank you so much for sharing this morning with us and for your continued support of JCRC. Good morning.
Thank you so much. Stay in touch.